Beshen? Okay. All right. All right. We'll convene the Dubuque County Board of Supervisors. This is a joint meeting with the Dubuque County Board of Health. Wednesday, April 29th, 2020, 10 a.m. I'm going to take a little well, I'm just going to mention that my saint of a wife, today is our 43rd anniversary. So as chair, I think I'm allowed to use a little discretion. So anyway.
Congratulations.
Thank you. I think I got congratulations and she gets condolences, but all right. Agenda item A, update from the County Emergency Response Team on COVID-19. And I believe we do have Patrice Lambert and Tom Beshen, Tom Berger. We have too many Tom B's for this part of it. The next part of the agenda, I'll turn it over to Tom Beshen for a Board of Health update. But Patrice Lambert or Tom Berger?
This is Patrice, and happy anniversary. That's good news to start the day.
Thank you.
I would like to, hi, you're welcome. I would like to ask if Tom Berger would like to begin, because my update actually rolls into with the Board of Health update. So if Tom wouldn't mind just starting with the update, and then Tom Beshen can begin with the Board of Health, and then I can give my update at that time. I think Tom Berger's on.
I can do that, Patrice.
Okay, thank you.
Just to give you an idea of the EOC operations, we did have our meeting with volunteer, well, not just volunteer, Dubuque Fire is involved too. Our fire and EMS agencies within the county last night, so we do that update every 2 weeks. So we had that. Not many questions or concerns were raised. There was some talk about some of the federal grant monies that are coming through the CARES Act right to the local fire and EMS for supplies and purchases. So we're working through that. There was some discussion about our mass casualty trailer that we house at Asbury and some of the needs that we have for that for updating, which this is going to be a good time to, we were already in the process. Actually, they did put in a DRA grant through the county association, county EMS association, to replace the trailer, and there's some content needs that have changed over the last year since that's been in service. So we're working through that with the county EMS. We do have our EOC situation report activation meeting tomorrow with community partners, and we're still doing that on a weekly basis. So that's how we're reaching out to the small communities, and other commission members. As far as the supplies, we did put another request in yesterday for some PPE, and we're anticipating the National Guard will be delivering sometime either late this morning or early this afternoon. So working real closely with long-term care facilities. Any other requests we try to get handled right away as a high priority. The request from the hospitals in the last couple of weeks has leveled off a little bit, so I'm assuming that they're getting donations, as well as had another company that I'm working with now that has 15,000 of the surgical masks that they want to donate. So we're still getting donations, even from regular community members. So we picked up a couple last week as well. So our supply is doing pretty well here, and we're meeting the needs of the healthcare community and fire and EMS for sure. So that's kind of the report of where we're at this point. Questions?
We have questions for Tom Berger. Okay, thank you, Tom.
No questions for me.
I'm assuming you'll be available if something does come up?
Yeah, I'll be on the call. You know, a lot of this is possible by the allocation from the supervisors, so that's extremely helpful, allowing us to do what we can on the local and obviously what we get from the state. But I appreciate that, to be able to get out to the people that are on the ground and doing the work with the patients. So I appreciate your help there.
Okay, that is a really nice looking shirt that you got on there.
You like that, Dave?
Yeah.
Yeah.
Yeah, from one
Go
fellow Ram fan to another. So, all right. At this point, we'll go to at the request of Patrice, we'll go to item B on the agenda, which is County Operations Response Plan, and under B1, Board of Health update. So at this point, I'll virtually turn the gavel over to Mr. Tom Beschen, the chairperson of the Dubuque County Board of Health.
Who got out here today?
Yeah.
Recognize anybody, but it didn't really pay too much attention either.
You should have seen.
Is Tom Beschen on?
You should have seen
No,
yesterday.
he's not on you. He's not on you.
Okay,
Okay, can I then,
Here we go. Tom is on here.
Okay. The two items we have on our agenda this morning are, first of all, an update on the request for the strike team at Dubuque, and secondly, an update on the testing criteria. I'm sure Patrice will include the strike team request in her update, so I'll turn it over to Patrice.
okay, thank you very much. And I think Tom Berger is still on. Can you mute Tom? I can hear his voice still. I know he's got many conversations going on as well. Okay, I thought I would just start by giving you an update. As you're all aware, we did find out yesterday that one of our long-term care facilities is
Sorry about
experiencing
that.
Oh, that's okay, Tom. Okay. One of our long-term care facilities is experiencing an outbreak. So I'm sure everyone is probably wondering the update on that. And I would just like to start by saying Stacy and I had numerous conversations yesterday, not only with the long-term care facility, but with the Iowa Department of Public Health. And we did request through our incident command team, through Tom Berger, through our EOC, for a strike team to come and do the testing. And this was after we had talked with the long-term care facility to do the testing on all of the residents plus the staff members that were there. Well, then Stacy and I did have a conversation later on yesterday afternoon, another conversation with the Iowa Department of Public Health, which I'm, at this time, if you don't mind, I'm going to turn the conversation over to Stacy Killian, because she will give you an update and she will include our last conversation with Iowa Department of Public Health, which I think is very exciting news for us. So is Stacy Killian unmuted?
I think so. Can you all hear me?
Okay. Yep. Thank you, Stacy.
We can hear you,
Thank you,
Stacy.
Patrice. Wonderful. I just want to quickly thank the supervisors, Wickham, Baker, and McDonough and the Board of Health for all the support that you've given to VNA and to our incident command team. It's a tremendous job that we're all doing, and it takes all of us to combat this. So, like Patrice said, we got some exciting news yesterday. Iowa Department of Public Health contacted both of us and let us know that they were launching a new initiative starting today. And that initiative is they will be contacting every long-term care facility that has at least one positive case and offering testing to all residents and all staff of that facility. Priority will be given to facilities with current outbreaks. So in terms of our outbreak in Dubuque County, Dubuque Specialty Care will be getting contacted by Iowa Department of Public Health, and they will be offered testing to every staff member, and then also every resident as well. So for us, this is a tremendous step forward. I think we've all been on the same team wanting increased testing to reduce the spread, and I think we're finally starting to see the progress that we've all been waiting for. In terms of BNA's work with Dubuque Specialty Care, like Patrice said, we've had several conference calls with them and with Iowa Department of Public Health to assess their immediate needs and review the situation and offer guidance to reduce the spread. BNA has been in daily contact with them to review those who are positive, those who have been tested, and what is being done to isolate the sick. BNA continues to offer support to the facility to answer any questions they have, assist them with facility plans, staffing levels, and staffing contingency plans, help support them with strategies for transfers to the hospital, positive cases within the facility, and working with Iowa Department of Public Health on infection control practices to reduce the spread. Our incident command team has continued to offer support with assistance in requests to the state, assistance in getting appropriate PPE needs, and assistance in coordinating needed collection kits. I spoke directly with Dubuque Specialty Care yesterday regarding our meeting here today, and the facility has been wonderful to work with. They've expressed their wish to be transparent at this time, and they have asked that I can share some of the following information. Yesterday, they released they had a press release that should have been issued out yesterday or early this morning that will go out with some more details from their facility. They currently have 40 test collection kits that were given to them from Iowa Department of Public Health, and they have the ability to order more so they can continue to test who they feel needs to be tested in the facility. Their biggest need that they've shared with Public Health at this time is staffing. They're currently looking at contingency plans should staffing levels get critically low or ill, and looking at contracting other staff outside of the facility as well. And then lastly, I had asked them if family members or friends in the community wanted to contact to check on their loved ones in the facility, who should they contact? And that is Brooke Baines. She's the administrator of Dubuque Specialty Care, and then she can answer questions. Her and her team can answer any questions for anyone looking for more information regarding their loved ones in the facility.
Stacy.
Thank you, Stacy.
Dave Baker, could you repeat that name, please, so that it kind of ran in with the sentence.
Absolutely. It's Brooke, and the last name I believe would be pronounced Benz. It's Benes, and she's the administrator at Dubuque Specialty Care.
Thank you.
And then what Stacy and I have also been thinking since all of our discussions yesterday was with the Iowa Department of Public Health contacting the long-term care facilities, they will bring a team to the site to do the testing. But then what Stacy and I have been talking about is what, for any situation, what if we do get an increase of positives? So we've been looking at how we can handle that caseload with the communicable disease nurses as well. And we think we have a plan in place for that as well. So we're feeling very good about having the testing being done with the long-term care for the staff and the residents, as well as our follow-through with the assessments through the communicable disease nurses. So Iowa Department of Public Health, like Stacy had said, as well as the facility, has been phenomenal. I mean, they have really reached out and helped us. Stacy and I have made calls to them, and they get picked up. Our calls get picked up immediately. So we really feel as though we have a good working relationship with the long-term care facility as well as with Iowa Department of Public Health. So that's our update with the long-term care outbreak. A lot was done in a matter of one day yesterday. So, and we know that our work is just beginning. So does anybody have any questions on that before we move into our next strike team request information?
Patrice, this is Susie Stroud.
Sure.
I don't know who else was talking, but I have a couple questions. One, with 40 kids, are they just going to test everybody in that long care facility, or what's the algorithm they're using to test? And two, if we need more workers, are they pulling from other long care facilities and then those people are going back to their original facility? Like, I'm wondering how, if you need more workers, where we're pulling them from, and if they're going to be going and almost cross-contaminating other long care facilities if they're working in there.
Patrice, this is Stacy. I can actually answer this for you.
Thanks, Stacy.
Okay. Sure. Susie, I know Iowa Department of Public Health has been working very closely with this long-term facility and then also others on no cross-contamination. I know that they've talked extensively with a lot of the long-term care facilities that I've been involved with to ensure that staff are not going from one facility to another, because I think that's when we start to see the spread. And so in this facility, I think they're still looking at what their contingency plans can be, and that would be, calling in having additional staff work additional shifts, things like that. So I think they're still working on that. In terms of the testing, the facility has requested that all members of this facility be tested, every resident, regardless of symptoms, and every staff member. And I agree. I think that's the best route for them, and catching this early and trying to stop any spread within the facility. So it looks like every single member will be tested.
Okay. Thank you, Stacy.
You bet.
And Susie, with the 40 kits that the long-term care had, those were sent yesterday morning, and then IDPH contacted Stacy and I with the new initiative that they had just learned about 5 o'clock yesterday afternoon. So the 40 kits were sent to the long-term care for their use, but the new initiative was not announced until later yesterday afternoon.
Okay, thanks for the clarification. I was just
Sure.
I was just really worried that only people with symptoms were going to get tested, and then it was going to go out of control. Thank you. I appreciate that.
You're welcome. Sure. Then Diane, did you have a question?
I did. The request went in for the strike team. Have you been notified whether or not? And is this the same strike team that you requested over the weekend?
No, this is a separate strike team request. And actually that was placed in yesterday afternoon, and that was before IDPH contacted Stacy and I with their new initiative. But we did ask if we should withdraw the strike team request for the nursing home because we had already submitted it, and they said no, that they would catch it at their end. So that one, we put in yesterday early afternoon, but the Iowa Department of Public Health contacted, like I said, Stacy and I about 5 o'clock yesterday afternoon with a new initiative.
Thank you.
Sure. And I can, since you asked, sure.
Patrice, this is Ed Rayburn. And before you get to the exciting next announcement you're going to have, I had another question about the testing that they're providing at this nursing home and then the other the long-term care facilities in the county. Number one, when you said the other long-term care facilities, did you mean all of the other ones in the county, including like those that are not in the city of Dubuque? And my other question was, in terms of testing, will they be doing the viral nose swab test, or is that in addition to the antibody test that I heard the governor a few days ago when she was talking about the first day, last Friday, when they did it in Tama at a manufacturer there, the governor said that they went in and offered both of those tests. So I didn't know if both of those were part of the plan that they were offering to do here, or just the virus test.
Okay, well, I will. Oh, Stacy, go ahead.
I can answer part of that, and Patrice, if you can probably answer the other half. And in terms of the long-term care facilities, it will be statewide. All long-term care facilities that have any positives will be contacted from Iowa Department of Public Health. Those with outbreaks will be priority. So it could potentially be every single long-term care facility that are displaying any positives would get contacted. I'm assuming just because of the sheer volume, it'll probably be in a staggered way, just so they can keep up with the demand of this. But this is a statewide initiative, so definitely we will see more than just this long-term care facility receive this initiative.
And we did briefly talk about would it just be the nasal swab or would it be the serology? And it's the person that we were talking with had said that they were just informed of this initiative 30 minutes before she called us. So she did say that some logistics still had to be worked out. So we don't know what type of, it would just be a swab or a serology or both.
Teresa Ann McDonough. So the new initiative is a statewide initiative, correct?
Correct. Yes,
okay.
Correct.
And what is the title of that new initiative? How are we going to call this for reference?
I would probably, and Stacy, you can jump in, but I would just say it would probably be the new long-term care testing initiative by the Iowa Department of Public Health. Because
I agree.
they're strictly, okay, and they strictly had said that they were looking at yesterday afternoon 400 nursing or long-term care facilities with their discussion. And I don't know if there's more than 400 long-term care facilities in the state of Iowa, or if, like Stacy had said, they were going to, their priority would be with those that had outbreaks and then those that had at least one positive. And then they would branch out from there.
Okay, so then when we focus on Dubuque County, this is a new statewide initiative in Dubuque County. They're going to be looking at nursing home facilities or long-term care facilities with one positive or more. An outbreak is 3 or more positive tests, but one outbreak or more. Do we have any idea in Dubuque County how many of our long-term care centers have one outbreak or more?
We have only been notified of the long-term care outbreak as of yesterday.
So we don't know if there are positives that you can disclose at other long-term care centers?
No.
Okay.
And
then the time frame of how we will, as we look at testing, which is the conversation that this group has ongoing, with if the state is not going to put some strength behind this initiative, we could be some months away from getting our turn at the new initiative testing, right?
Correct. But it did sound like this initiative was going to be, well, like as Stacy had said, they were starting to contact all of the outbreak facilities today. So it did sound as though it was going to be an aggressive approach for all 400 of the long-term care facilities. But yes, as far as how many staff they have, what the travel would be, I'm sure that for the whole entire state of Iowa, including Dubuque County, some of ours might be delayed. But I would only think if they were sending, this is me personally thinking, if they were going to be sending a team in, I would hope that they would concentrate, on more than one facility if possible, instead of having to come back for another facility in 4 days or whatever the case. But that's just my personal thinking. But I know that they were going to do an aggressive approach starting today with the outbreak long-term care facilities.
But the outbreak care facilities, that's what we keep talking about, is outbreak versus a positive, right? So we have one outbreak facility in Dubuque, which is Dubuque Specialty Care, because they've had 3 or more positives. But we have other positives in long-term care centers in Dubuque, but they're not outbreaks because they don't add up to 3 or more.
We cannot disclose any of that information, at all. But what the Iowa Department of Public Health had said, and I do stand corrected, that they will start notifying if there's one positive and outbreak starting today. I had just mentioned the outbreak.
Patrice, this
sure.
is Diane Page Freiberger. I had sent that email earlier today. Have you had a chance to check whether one positive within that building, within a long-term care facility, is that one a resident, or could that also be a staff?
I did send a clarification email, which I had responded to you by saying I believe that they report both staff as well as residents, but I did send an email to Scott for clarification this morning after I had emailed you, and I have not gotten a response back from him. So once I do, I will share that information.
Thank you.
And this is
Stacy,
Stacy
do you
Killian.
know? Yeah, do you
and
know?
So I believe it would be staff and residents, either one. A positive would account for them to come on either one. And your question about, I know specifically yesterday on the phone, I asked Iowa Department of Public Health how quickly they would respond to Dubuque Care Facility, and they did state that they would be calling them today. So I feel like it might move faster than what we're hoping, but I know in terms of outbreaks, they're pretty quick in their response time. So with this new initiative, their intent was to call to be a care facility today.
I am excited about the new initiative. I don't want folks to feel that I don't think it's valuable. I think it's just noteworthy that the time frame, you know, we have been fortunate to be a community where we haven't had numerous outbreaks meeting the state's criteria of 3 or more positives. So that's great. But we also know that we have individuals who are not feeling well, who work in some of our community centers. So if they're coming, I'd like to have them truly help us as a community and look at all of our long-term care staff and residents, regardless of whether or not they have 1, 2, 3, 7 outbreaks. It would be nice to have them actually help us get testing with this very vulnerable population.
I think we agree with you, Ann. Most
Absolutely.
definitely. I think Dubuque County has been very vocal in their push for wanting increased testing for the residents, and I think they are hearing us, and so I hope that means we continue to trend further with increased testing as quick as we can.
This is Dave Baker. This is the stuff that keeps me awake at night. Our long-term care facilities, nursing homes, and similar facilities that, such as Hills and Dales, ARC, and other places that have residential facilities where the residents stay there full time. They live there, and it has been a frustration. I appreciate Supervisor McDonough's comments and questions, because I have similar feelings and views, and I have been frustrated in the I guess with IDPH, because 1 and 2 apparently equals 0 prior to this. 3 equals an outbreak. And I don't think most people were aware that you could have a facility, because there's also, under their rules, their guidelines, after a certain amount of time, that first 1 or 2 disappears. So you could literally have 6, 7, 8 cases in a facility over 2 months, and nobody knows about it. Fortunately, in most cases, the people who work there or people who have family there are not afraid to speak up, and that's a good thing. And I do know, I believe that there may be some folks who have loved ones at this particular facility, Dubuque Specialty Care, that may be participating in this meeting. And I'm gonna ask Chair Beshen if he would try to identify those folks to see if they have questions or comments for Stacy or Patrice. And to maybe Tom doesn't have the ability to do that. I'm sorry, Tom, apparently that would be.
On the line, if someone wants to ask a question, there seems to be a lot of questions being asked. So if someone has a question for Patrice or Stacy.
Dawn Sherman is saying if they'd like to ask a question and they're on the Zoom, to raise their hand, use the raise your hand button. Or put something in the chat room.
Okay.
Okay. Apparently we do have Mary. Mary, you're unmuted. I'm sorry, Tom, but I'm getting this right from Dawn, so I'm trying to translate.
Yeah, I can Dave.
Thank you, Dave. Yes, my name is Mary Brumeyer, and my mom is at Dubuque Specialty Care. I just spoke to them about a half an hour ago. She has not been tested. They don't know when. They have had conversations with IDPH. They don't know when. They hope maybe sometime this week, but there is no definitive time when they're coming in to be tested. And that concerns me greatly. And I don't know how we can push to make this happen sooner. I mean, there's already 3 residents and a staff person. They won't give me any information as far as how close these residents were to my mom's room or anything else in regards to, the potential risk that she has.
And Mary, we understand your concern, but please know that as far as residents being placed, in which room or whatever in the nursing home, that we would again encourage you to contact the nurse administrator there. We don't have the specifics of what you're asking on that. But as far as the testing, again, I can share with you that our conversation that we had with IDPH last evening was that they were going to be contacting the nursing home for the testing today. So we can follow up with IDPH and see how long that process will take. But again, that is going to be controlled by IDPH, but we can gladly see if we can't find an answer. So, Mary, I'm just wondering how we can get back to you. How does somebody have Mary's information at all? Or Mary?
Dave would have my information, and you're
okay.
welcome to share it. I can give you my.
No, we'll go through Dave.
Okay.
No, as long as Dave has your information, when we find out an answer, either way, we will get a hold of Dave and he can share that with you, Mary, because we do understand your concern.
Well, the frustrating part of this whole thing is they knew last Wednesday, a week ago, that a resident tested positive. They were doing contact tracing, and they could not tell me anything as far as if the staff members that were being tested or the resident were in close proximity to my mom. And I still don't know that, and it's a week later. And that's really disconcerting because we're talking constantly about the speed at which everything is happening, and it just doesn't seem to be there in reality.
Mary, this is Stacy Killian, and I have a pretty good consistent relationship with this care facility. So I will pass along your concerns. I obviously don't know logistics of residents that are there, but I will certainly pass along your concerns and ask that somebody follow up with you from that facility today, because I really think you do need to have your questions answered. And we really are listening and doing the best that we can here. So I will pass it along when I get your contact information from Dave and ask that somebody at that facility contact you today.
Okay. All right, thank you. I appreciate that.
Not a problem.
Okay, Don, was anyone else raising their hand?
Chairman Besher?
Yes, Ed.
I don't know where the raise hand button is, but I can just raise my hand. I just wanted to make sure that the notes that I had written down were what Stacy and Patrice meant. What I heard was that for the 400 long-term care facilities, and I think that is about the number in the state of Iowa, their first priority of this initiative would be to go to the facilities that have had an outbreak and do complete testing there, although we don't exactly know what that testing entirely entails, but they will test the residents and the employees. Second priority would then be those facilities that at the time have had at least one positive, but haven't had an outbreak yet. And third would be facilities that have not had any positive tests yet. Is that correct?
Yeah, this is Stacy. This initiative will be for long-term care facilities that have had at least one positive. So I had asked specifically regarding Dubuque Specialty Care when we were on the phone as they were dealing with an outbreak, whether facilities with outbreaks would be targeted first, and the answer was yes. But every long-term care facility that has had at least one positive will get contacted by Iowa Department of Public Health, and all staff and residents will have the ability to be tested, regardless of symptoms.
And those that have not had a positive test yet, they haven't indicated what the plan is for them yet.
Correct.
Gotcha. Thank you.
Stacy or Patrice, this is Supervisor Wickham. Can you hear me?
Yeah, sure.
Did the Iowa Department of Public Health give you any direction related to the timing? This is not the first outbreak in a long-term nursing care facility. Do they feel or think that this will be a one-day or one-week process that they'll be able to get people tested, both employees and residents? How soon would they be testing?
They did not give us a time frame, but judging from the questions, and they had already come back with questions regarding this facility. How many staff do they have? How many residents? Whether or not they have their own occupational health staff available. So I believe that they're going to move very quickly on this. They did assure me on the phone verbally that they would be calling them today. But again, that is a lot of facilities across the state, and I don't have any indication of how many staff they've directed towards this initiative. But it sounded to me on the phone that this was a very high priority for them and something they would be moving relatively quickly on.
Can you ask them how quickly they responded to others? That may give you some sort of leading indication. So like we were not the first, they've probably done this at least 10 times around the state. Yeah. And so if they've responded in a week, then we at least have some general assumption that they would respond to us at least in a week related to our testing. So if you could ask them that, how soon they've been able to test at other facilities, that might give us an indicator at least that we can pass on to residents and staff and their care providers.
We absolutely can do that today.
Thank you.
And it's my understanding that before this initiative was announced last night, they did do the testing through the strike team. So the strike teams might have had a longer delay in getting that out versus this new initiative. But no, we'll be glad to ask that as well and let you know.
And this is Diane Pape-Freiberger with a kind of technical question for both Patrice and Stacy. With those 40 kits that they send, collection kits to Dubuque Specialty Care, are those test tubes that have the swab, that you put into saline? It gets taken outside, and then I assume that's running right to IDPH, or does that go to UCL and then to IDPH? I'm just looking at logistics here, time frame. If we have the availability, if they're not going to be able to come in for a couple of days, can we tap into UCL and get some of those kits from them to be tested on these individuals so that more can get tested in a quicker time frame? rather than waiting for them to come or for them to send more test kits or collection kits. I'm just looking at trying to get the results back sooner, number one, for the residents, the employees, but also for their families. The sooner that they know this information, it may be able to settle some of their fears down.
Sure.
Yeah.
This is
And
Stacy. I'll just,
okay.
I'm sorry, Patrice, I'll add first.
No, that's
you add
okay.
in. I do know that with the collection kits for the long-term care facilities, they can be given those. I don't know what they have in terms of kits, and I don't know what the process is for the lab. I do know they can use it to test who they feel needs to be tested. And again, each facility I think is a little different in how they do that, and I don't know the direct process, but that's something that we can talk to not only this facility but others and find out, because if they do have that, you're right, there may be a potential to get additional testing quicker. Again, I don't know the specifics, but it's something that we absolutely could look into.
Well, and this is Diane back, and from a Board of Health standpoint, I would like to see if they're not going to be able to respond in a timely fashion, i.e. not for a couple days because they have other outbreaks through the state, I would like to see us use resources that we have available within the city, you know, to get more collection kits into that institution, whether it's that they need to have someone go in and do the testing or whether the staff is doing the testing. And they're all going to be run at State Hygienic Lab anyway. You know, it's whether they have the testing ability other than the 40. I assume there's more than 40 residents and 40 staff in that location. So I'm just questioning whether if it's going to be not be able to be, the testing cannot be done for a couple days, waiting for them to come or to send more collection kits. Can we use the resources of UCL?
Sure. And we'll be glad to check on that, Diane, and we'll let you know. Because we don't know that answer as we're
right. Well,
talking.
I'm just proposing that.
Sure.
Yeah,
Sure.
I'm proposing that so that we get these individuals tested.
Absolutely. Thanks.
This is Dave Baker, Chair Bash, and I'd like to just make a comment, ask a question. There's some in the chat section on Zoom. There's questions about whether IDPH's cloak of secrecy is actually required under HIPAA, and there's questions being raised, and maybe we should have, I don't know if County Attorney CJ May is on the call. Maybe we should have him look at that so that our folks on the local committee can be more forthright and have better communication with family members, because it's got to be very frustrating for family members not to be getting information. So I will, I'm not sure if County Attorney May is on, but I will, as chair, ask him to look at that.
Yeah, I'm here, Supervisor Baker, and I'd be happy to do that.
Thank you, sir.
Thank you.
Okay. Okay. So was there anything else, Patrice or Stacy, from the strike team request?
Yes, I can also tell you that we did submit the strike team request my days are all mixed up, Saturday. We entered one on Saturday. The governor's office called me on Monday, and then again, they did contact me this morning. It was a brief conversation, but again, that sounded very positive. She was on looking at the logistics component. So she is going to be following through with that, but it did sound as though we still don't know how many or what population, but it does sound as though our request is moving in a positive direction. But she just wanted to call to tell me that they are looking at it, and now they're looking at logistics, so more will be coming. So I took that as a very positive component as well.
Thank you, Patrice.
Uh-huh.
This is Supervisor Wickham. Going back to Diane Pay-Freiberger's kind of comment or question, why would we want to wait if we have the ability to do the testing right now at that facility locally? If we feel we have the expertise and the supplies, why wouldn't we proactively move in and assist that facility and those residents and the staff members and do the testing immediately?
Yeah, I don't know. I mean, I think it makes good sense, but I don't know. I mean, we just need to be calling to do some discussion to see if that's even possible.
Would the Board of Health be interested in that?
Absolutely. I mean, I can't speak for the Board of Health, but it sounds from Diane Freiberger that yes.
This is Diane Heiken. I just wanted to clarify. Diane Freiberger, what you're talking about is the collection of the kits. We don't have the ability to process those here, correct?
That is correct. They would be then sent to state hygienic lab.
Okay. So how many people need to be tested at that long-term care facility, Patrice?
With the Iowa Department of Public Health new initiative, it's our understanding they will do everyone, staff as well as residents.
So how many staff and residents are we talking about? If we're looking at numbers, we have 40 kits.
I believe it was 80. I wrote it down here. Stacy, do you still? Oh, it's let's see. It looks as though 85 staff members and residents. I believe it's 60.
So we have the ability in Dubuque to run them or to collect them. Because we are being told by UCL for several weeks that they had 18,000. So I, as a Board of Health member, would like to make a motion here. I don't know if it's appropriate or not, but I believe that this is also our meeting. So I would like to make a motion here that utilizing United Clinical Labs.
First of all, excuse me, Diane.
Resource.
This is Tom.
Okay, go ahead, Tom.
Before you can make a motion, I need to verify that we have a quorum. And
I had looked at that. We had Tom Beshen, Diane Heiken, Todd Lang, myself, Susie, and Val, unless some of them left.
Okay. All right. In that case, we do have a quorum.
Okay. I would like to make a motion that the critical management team, the incident management team, utilize the resources that are available within the city of Dubuque by utilizing resources of United Clinical Labs to obtain specimens, nasal swab specimens from the residents and staff of Dubuque Specialty Care.
Are you going to have discussion? Because I do have a couple of concerns.
Okay, I'm
sorry.
We'll need a second before we can discuss.
Okay, I'm sorry.
I'll second. This is Valerie.
Okay, thank you, Val. All right, now we'll open it for discussion.
Okay, my first concern is if we need to receive a doctor's order. We would have to work with that long-term care to find out who their physician is to order that. My second concern is if we do have a new procedure in place, I still want to check with Iowa Department of Public Health, because if this were to put any barriers into their initiative, which we don't know, maybe it will, maybe it won't, I would rather not have the request made like the motion, but it can stay like that. But again, if Stacy and I talk to IDPH, and if they say no, it has to be this way. We will come in, do the whole entire residence, staff, and everything else. But if you do your own initiative, we will move on to the next long-term care. Now, I don't know if that's even in their minds at all. I think they would probably accept the additional help with the testing, but I would hate to do something and then completely find out that IDPH is saying, no, you can't do that. So I just wanted to throw those out.
This is Susie. I concur with Patrice. I mean, we need to find out that whole process because it also has to do with tracking and whatever they do when they come in, waiting a half a day and making sure that the tracking and the orders and everything is in place with the strike team would be a whole lot better than us going in and not having a process in place and maybe having something slip through the cracks. So, yeah, if we can get that information from IDPH and what the strike team does and what they want, if they happily accept that we just start collecting samples or collecting tests, then absolutely go ahead and do it. If it's going to screw up their process at all, if it's, maybe the delay is a little bit better just so we can get better care, better tracking, and a better process.
Thank you, Susie.
This is Diane Heiken. Patrice, do you know the rationale for why they sent 40 test kits to a facility that would need, 145 people?
Diane, this is Stacy. I can actually answer that because on our conference calls with this facility, Iowa Department of Public Health has been sending it any request. So if a long-term care facility requests a number, they send it. And so I think they've been requesting them because I think this is not the first shipment that they've received, but this is how many they have on hand today. Because I know Iowa Department of Public Health had told them that if they need more, all they need to do is contact us and more will be given. And I just sent an email out based on Supervisor Wickham's question about how long this would take. I also added some additional questions to our representative at Iowa Department of Public Health and asked, would it be easier? Is there something we can assist locally that would move this along faster without creating a barrier and how that process could work? So hopefully they would get back to us relatively quickly and answer a lot of the questions that are on the table right now.
So your understanding is if the facility requested 145 test kits, they could have those?
Well, Diane,
go ahead, Patrice.
That request with the 40 was done yesterday morning when they were identified as having an outbreak, but the new initiative did not come until 4:30 yesterday afternoon. So we don't know what, if there were rules and regulations attached to that new initiative that would knock out the request of the 40 that morning. That's what we don't know, and it sounds as though that's what Stacy is sending the email on right now.
And this is Diane Pate Freiberger, and I respect that. There's just, I don't know. We don't know. We have to prepare for if it's going to be 2 days, 3 days before they're going to be able to get those kits, the collection kits in, whether it's serology or whether it is the PCR. So my proposal is, my motion was based on that they were going to give you a response that it was going to be longer than a day before they'd be able to do this. If it's longer than a day, then I still think that we should be going into these institutions now and testing everyone because we have the availability inside our community to do that. We cannot run the test in Dubuque. All of them will be sent to State Hygienic Lab unless it's serology, and that would not give them the data they want right now anyway.
This is Diane.
Okay.
Go ahead. Well, I'm just wondering if we can just, I don't know how specific your motion was, Diane. I'm a little confused right now, but if it's not a bad idea for us as a Board of Health just to use our funding to acquire, say, 200 test kits that we just have available to us to have in case this happens again somewhere else, or you know, it sounds like what you're saying, Diane Pate Freiberger, is that they exist in our town, our county, our area. If we acquire them, then if we do feel like we need to get them to a facility or somewhere, then we have them. Does that make any sense? I mean, maybe we can go ahead with this motion, because if we don't now, and we find out in a day or two they're not sending the needed tests to this facility, then we don't have another meeting till Monday. Then we have to try to call special meetings. Can we just have some on hand based on this scenario?
I think
and
we
I do
still,
understand.
Oh, sorry.
We do need a physician order, but each facility, I've worked with these facilities, each facility has a physician on, you know, that they contact. I do not see in this situation that even being a barrier at all. I do not have a problem with that. And we do not want to put a barrier if a strike team was going to be approved, but if we go ahead and do testing. But we also need to get these individuals tested in a timely manner, which I'm saying is today. If they're going to tell us, and the response could be, we're sending you a strike team in 2 days. That's too long as far as I'm concerned.
And Diana, it would not be a strike team.
Go ahead.
Oh, I'm sorry. No, go ahead,
That's
Susie.
okay.
I was
That's
just
okay.
clarifying that the strike team would not come with the nursing homes, is my understanding. It would be their new initiative. But go ahead, Susie. I'm sorry.
Okay.
Well, I'm just thinking, okay, so they sent, I need to clarify this so I understand it in my mind. They sent 40 tests, correct?
Correct. Yesterday
to the nursing
morning.
home? Okay,
Correct.
so they're all, and we're collecting those, correct?
Well, Stacy, do you know, do they actually have the 40 or did they request the 40? I don't know if they even have them on hand.
They have 40 collection kits in-house as of right now.
Okay.
So we're already collecting?
Yes.
Okay.
Well, they are.
So,
I mean, I can't speak for the care facility. I don't think that's fair for me to do that.
Yeah.
But I do know that they have the collection kits on hand and they are able to test.
Okay, so if they have the 40 and if they're starting collection, I think a lot of this conversation, we need to find out the facts from the strike team before we even start supposing and going forward, because collection is happening. We need to find out the process from the strike team so we don't interfere with that. So I think that question needs to be handled first. And maybe we need to have a meeting before Monday so we can find out that information and we react when we have the information. Doesn't do us any good to have plans if we don't have all the research done and we don't know what we're talking about.
Susie, this is Tom Beschen. I'd like to add that, this facility, if they have positive tests already, they had some test kits they were using. So is it possible they may have more than 40? Do we even know that?
Tom, this is Stacy. I do know in my conversations with them in the state, every conversation the state has asked, do they have enough collection kits as they need? If not, they just need to reach out. So my guess is they probably have had several over time periods, but they do have the ability to get them from Iowa Department of Public Health as needed.
Okay.
Okay, I know we have a motion on the floor, so maybe we should take, I'm sorry, Tom, I don't mean to be stepping on any toes, but maybe we'll take care of that motion and maybe we talk about having a meeting before Monday. So maybe we can find out some of that information and then we can make decisions on the information we find out.
See, and Susie, before we're still in discussion right now, and my response is regarding waiting. Number one, it would take calling a special meeting for us to vote on this motion tomorrow because they found out they can't do them today or tomorrow. So we'll have a special meeting so that that they can test the next day. I'm talking about the timeliness. We're talking about a very fragile population that's there. We're taking a look at throughout the whole country, when it enters into these residential facilities like that, it takes lives. And that's a concern not just for the healthcare providers, but for their families also. So my motion is based on if if the Dubuque Specialty Care cannot get that testing done today for the rest that have not been tested, that the rest can be tested today. We have the availability to do that, and that's where I'm coming from. I'm not coming from, well, we got to wait for the resources to come from IDPH. The resources are here in Dubuque, Iowa. That's where I'm coming from.
And
Okay.
This is Patrice. Can I add one other thing? I'm just saying honestly what I feel. I believe that with the discussion that's on hand, Stacy and I can follow through with this without a motion being in place. My only fear with a motion being in place is if we come to that nursing home stating that this has to be done, you have no choice. I don't want to put up a barrier with them. I truly believe that we know what the motion is. We know what your request is. Stacy and I need to do some follow through with IDPH to make sure that we are not going to be hindering or completely blocking what the new initiative may be. And if they say no, I truly believe Stacy and I understand what you guys are saying. We would call that nursing home, we would work with them, and we would do everything in our power to get the testing started, or if not completed today. But you can make a motion if you want to.
Patrice, this is Diane Pape Freiberger. I have made the motion. It's been seconded. I would like a vote on that.
Okay. All right. I'm going to call an end to the discussion now. But we will take a vote. But I want to say that I agree. Patrice makes a good point about not getting ourselves crossways with IDPH. So, since I can't determine who is voting which way, I'm going to do it by roll call. So the motion on the table is to move forward with testing from the UCL supply of test kits. So, and that was made by Diane Pape Freiberger, seconded by Val Pekash. We have, I'll just go through the roster. Diane Pape Freiberger, your vote?
Yes.
Aye. Diane Heiken?
Aye.
Val?
Aye.
Todd?
Aye.
Susie? Susie Stroud?
Yeah, sorry. No.
Tom Bashan, nay. And let's see, I believe, is there any other Board of Health member on the call? Okay, so the motion was carried 4-2. Okay, motion carried. So how do we proceed?
I'll talk to Stacy, and it'll be between her and I to contact the nursing home then and tell them that the motion from the Board of Health was to begin the testing today.
Okay. Thank you, Patrice.
Sure.
Okay. Does that take care of things on the strike team, or is there more?
Nope, that's it.
Okay. The other part was an update on the local testing criteria, and I had, at the last meeting, we had talked about the possibility of creating a different algorithm for testing in Dubuque County. Dr. Konaru was in the process of speaking with Dr. Vanderheyden. There were several questions going on, or several questions to be addressed. Dr. Konaru was not able to join the meeting today. He said he'd provide me with an update prior to the meeting. I still do not have it, so I don't have anything to discuss there. I just know that from the discussions we've had so far, it would take a change in the testing algorithm. The issue of supplies or test kits is not at question. We have enough to support that, but it's a matter of who would do the tests if we broadened our criteria. So we will continue to get that question answered. Hopefully we can meet with Dr. Conaru and Dr. Vanderhayden yet this week. Any questions? Okay, that is the conclusion of the Board of Health section.
Hey, Tom, this is Susie. Can I give just a quick update on the mask? I sent out a spreadsheet, but can I do that here, or do you want me to not do it, or?
If, I don't know, are we limited with this agenda to what we can present? This is not a work session. Dawn, I'd ask that.
I think that could fall under the update from the emergency response team, as long as it's COVID related, which it is.
Okay, all right. Yeah, Susie, then go ahead.
Okay, so we are out of masks. We have handed out all of them from Dubuque Mattress Factory in the 1,500 we got from Right Height. We had a very surprise response from the table down at Key City Creative last Friday. We handed out over 1,000 masks in 3 hours, just Tim and I. So the response was great. I sent out a spreadsheet to the people in the mask committee and to the Board of Supervisors. In the city, we handed out almost 8,200 masks. In the county, from the numbers that I got from Bailey, we handed out 1,200. So it was a total of 95 masks that we handed out total. And like I said, we are completely out. So thank everybody involved, and I think we did a pretty good job in about 11 days getting almost 9,500 masks out to the county. That's it.
Susie, can I ask you a quick question? As you've noticed, we've been getting more requests, and I've just been forwarding them to you. Is that still okay to do? Okay, good enough. Thanks.
Well, I don't have any coming in to me personally.
Right.
I know that Tim's mom down at Key City Creative is still making them. I know he's had a couple donations. They're like 20 to 50 at a time. He doesn't have a lot down there. So I don't know where else I would point people to.
Sure. But you'll be the collection. You know, I don't want to ignore them. I just want to, in case you do get additional ones, can I just keep forwarding them to you?
Yeah, that's fine.
Okay, thanks.
This is Diane Page. I'm sorry, Patrice.
I was just going to say, and it was an excellent program. So thank you guys, all of you who are involved.
And Susie, this is Diane Pate Freiberger. Just a comment. Tim Hitzler's mother, who can make 100 a day, now she's been requested by Dubuque Farmers Market because they're going to need them for their vendors and for people that will be shopping down there. So she will not be a resource for us.
Well, there you go. Things are changing all the time. And I don't know where else. There is a group making them, and they're handing them out of Wags to Wiggles down on Central, kind of by Key City Creative. But they are limiting them to 2 a person, or 2 for one person coming in. That could be a resource for people. I've also gotten more requests as this goes on. If by chance I come buy more masks, I'll put it out in the community and see what we can do.
Okay.
Susie and McDonough, can't we refer people to there's various resources and materials about how to make your own?
And I still have some flyers that have on the back like no sew, do it yourself, and I have been handing them out. It's masks you can make out of just whatever you have around your house, t-shirt, pillowcase, sheet. And I've been handing those out. I don't know where else to put them to get them out into the community. I know Human Rights has some. I don't have any out in the county, but we can get those flyers out. I've got probably about 500 left. All the Marshallese ones are gone, and most of the Spanish ones are gone, but I still have a stack of English ones.
Mm-hmm.
This is Tom Beshen. I think, Susie, it would be a good idea to get them in the hands of the city clerks out in the outlying cities, and then, according to what I read, the farmers market is going to be opening up on the 16th. It would certainly be good to have a supply of those where people enter a farmer's market. They may not have them the first time, but if they make a return trip, they could very well have fashioned their own mask.
If, Dawn, are you on here? If I get flyers out to the West Campus, can we distribute them out into the county?
Yes, and I can work with Bailey. She had reached out to the city clerks to ascertain how many masks they wanted. So we'll definitely be able to get those distributed.
Okay, I can make that run tomorrow morning and get them out there.
Susie, even if you just wanted to send out one, we can send out as an attachment. I mean, if you just...
And I think I've sent the digital copy to you. Yeah.
Okay.
I think
then
sent...
Yes, I do have that. Yep,
okay.
We'll just use that. Nope, that's fine.
And then I'll keep the ones here, and I'll get them in hands of the farmers market people and some of the other organizations around here. And if anybody else has any ideas, email me. We'll do what we can.
Okay, thanks for the update, Susie, and thanks for your efforts here. That was a great job.
I would echo that as well. Tremendous job getting the distribution out in a very short time to a wide variety of people that have that need. So thank you very much, Susie, and the team. Great job.
Thank you. I will also report we had so many people walking around downtown stop by the table that made a comment that they wanted masks and they either couldn't find them or they wanted to make them and they didn't know how or they couldn't find what they thought they needed for materials. So I think we really hit a big demographic that we were hoping to. So.
Thank you, Susie. And with that, I will turn it back over to Chair Baker.
Thank you, Tom. All right. Any other questions, comments related to the COVID-19 pandemic? If not, we'll move on. I do want to also state that the effort by our Board of Health members and other volunteers that they've recruited to get masks out to folks both in the urban setting and the our smaller communities is certainly heroic, and I take my hat off to all of you for your efforts. Thanks again. All right, we're going to move to agenda item C, work session with Greater Dubuque Development Corporation representatives regarding Safe at Work booklet. And we have Kristen Dietzel, and I believe Kristen has been unmuted. So Kristen, I'll turn it over to you.
Hey, good morning. Can everyone hear me okay? Thumbs up.
Good morning.
Okay, great. Great, thank you. Yeah, I wanted to present a new collaboration initiative we're working on at Greater Dubuque Development in partnership with the incident management team, also with Northeast Iowa Community College, utilizing the COVID-19 business helpline that we launched on March 25th to further extend the resources available to local employers with regards to safety in the workplace. So I'm going to share my screen. Do I have the ability to do that? And just walk you through where we're at with this initiative. Let me see if I can do that.
Can she do that, Dawn? Okay.
Okay. Can you see that?
It is.
Okay. So this is draft. This has not been publicly released yet. I did share the draft of this Monday, I believe. Today, Wednesday. Yeah, Monday I shared a working draft of this with members of the incident management team. I understand this was also shared with the Board of Supervisors and others. And what we're really hoping for is to get endorsement from the incident management team. What we focus on at Greater Dubuque Development is communication with the employer community. Obviously, we are not experts in the health guidance. We have not created any new guidance with this initiative. Instead, it is really a framework and a model to assist employers with accessing and implementing the information as it becomes available from the IDPH and the CDC. So we're calling this Safe at Work in Greater Dubuque, and did implement this draft that I have up on the screen does incorporate any of the feedback that we have received from people on the phone and maybe others who aren't on the phone. So as I said, this is a local collaboration to assist Dubuque area employers. It's a resource focused on those employers that do not have specific guidance issued. So this would not be the appropriate document for long-term care facilities, healthcare, schools, essential services personnel that have additional specific guidance for those sectors released. This would apply to employers who are identified as critical infrastructure employers. So those are employers that would not close even in the case of an order to do so, which we do not have in Iowa, but they have had in surrounding states, as well as employers who may be reopening after a closure. Safe at Work does not issue new guidance nor recommend a specific employer plan. As you're familiar with, the information put out by CDC and IDPH has been careful to be listed as guidance, not a mandate. But rather, this is a framework to put all of those pieces of information together. And this is really a response to the employer community. So the COVID-19 Business Helpline is a partnership in place between Greater Dubuque Development, Northeast Iowa Community College, and the Small Business Development Center of Northeast Iowa. It launched on March 25th to first assist employers with accessing the Iowa Economic Development Authority's small business relief grants. After that, it extended to providing assistance to employers through 17 counselors with different areas of expertise in making application for the PPP program, the Economic Injury Disaster Loans, other local assistance such as the Dubuque Initiative's bridge loan funding, and then answering other questions related to unemployment insurance, the Families First Coronavirus Response Act, and a growing number of health and safety questions. So rather than us continuing to send employers maybe 10 different links from the CDC and the Iowa Department of Public Health, we wanted to do a little more education and put a framework and a support system around that. So this is made up of 4 parts: the employer framework, which I'll run through, employer support. So this is where they would go to find more information. Dubuque area vendors. So these would be local resources for PPE and CDC cleaning, compliant cleaning. And then of course, just the source documents. So the framework is really about asking employers to consider 4 questions. How do they organize their workforce to create a safe environment? How do they organize their workspace? How do they monitor that workspace to ensure it stays safe? And then what do they do if there is an outbreak or a positive COVID case in their workplace? So that first question is really about workforce assessment and risk mitigation. And what we did was distill the information and guidance that's available, pull out the primary steps the employer should take, and then refer them to a reference where they, or 2 or 3, where they can learn more information. So in the risk assessment category question, this is where they want to think about how they can work remotely with as many of their functions as possible. Even if their business has been identified as essential critical workforce, the Homeland Security guidance still asks employers implement remote work for certain positions or departments or functions when possible. And then to think about the options they are providing at-risk employees. So this would be making sure their leave policies are in order, modifying them as necessary to support extended sick or home quarantine, considering paid leave, and then thinking specifically about those employers with chronic medical conditions or in high-risk categories. And then we refer them to the OSHA document where you can break your workforce into high, medium, and low risk with certain recommendations for each of those categories. The second part about organizing your workspace, this is really the prevention. So implementation of social distancing practices, supporting social distancing and how employers perform work. So rearranging workstations, different layouts on the manufacturing floor, barrier shields, staggering lunch periods, creating different shifts to ease crowding at entry or exit times from the workplace. And then routine cleaning, disinfecting, discouraging sharing of workstation equipment. CIRIS, which is CIRIS is Center for Industrial Research and Studies, I believe, and they're out of ISU. They offer free resources for employers, specifically related to COVID-19. So they are a partner of ours. We have a contact that specifically works with businesses in Northeast Iowa. And so we've already participated in webinars with them and utilized some of their material in designing this. And while they do focus on industrial workplaces, they can work with any business, and their guides apply to any business. How do I monitor my workspace? So this is focusing on the Iowa Department of Public Health's most recent guidance to business and industry related to screening employees and visitors, having controlled entry points, and then having a plan when a positive case occurs in terms of communication with those employees. We did provide a screening document which has a more in-depth protocol as well as the algorithm that the Department of Public Health has put out. And then what will I need to do if there is an outbreak? This section came directly from the Iowa Department of Public Health. We do kind of have, you see a pink area here. This is where we still have an unknown. So, you know, we understand the IDPH guidance on when employees can return back to work, the cleaning and disinfecting protocols, the reporting to Iowa Department of Public Health if there is a 10% or greater absenteeism. So we've shared that link. The one thing that we have gotten some questions on that we still don't feel like we have a very defined answer is who employers should coordinate with if they do have symptomatic employees. So they might, have a screening process, identify symptomatic employees, send them home or send them to the doctor. But often those employers then want additional testing available and they don't know who to call for that. The IDPH guidance right now tells them to call their occupational health provider. And we did not feel confident that that was going to yield a positive result for employers. So we would really be looking to this group, the Incident Management Team, Board of Health, to identify the path that we should offer to employers when they do have symptomatic employees and want to do additional testing on site. So I'll be listening for feedback on that. And then this is probably the most important part to understand. As you can see, the other guidance is really kind of repackaged into a framework with references. But we plan to utilize the COVID-19 business helpline as the support system for employers to have someone to walk through this guidance with. Of course, it'll be available as a web-based tool. We do not plan to make this hard copy because this information is changing so quickly. We want to be able to immediately respond when IDPH changes or puts out new guidance, or same with the CDC. The business helpline, just to give you a sense of how the awareness around it, it launched officially on March 25th and has taken over 500 calls from area businesses. Those range from some of our largest businesses in the community to sole proprietors. So it's really reached a wide audience, and our staff at Greater Dubuque Development have made 971 personal phone calls to the businesses in our community to raise awareness about this helpline and let them know it's here for support. So it's been pretty well established in the community, so it made sense to us to utilize this as the contact and triage point. Based on the calls that come in, we are working on a triage process. I'm going to pull this other document up. This would not be part of the public-facing guide, but this would be something that those helpline counselors would have in front of them. So if an employer asks a question that cannot be answered based on the guidance available, we've identified expert contacts that we can call on to hopefully find an answer or recognize that we have a gap in our employer community for a certain issue that we need to address. And then in addition to the web-based guide and the business helpline, which would provide personal one-on-one support, we plan to invite business owners to participate or view webinars related to Safe at Work. So it would be a training webinar walking through this information, showing them the links and walking through those resources, as well as live webinars where we can take questions or address new guidance. So let's say there's new guidance issued on Friday. Monday, we might ask the partners involved in this to participate in a webinar to the employer community where we can release that new guidance and talk through how that changes Safe at Work protocols. An example would be last Wednesday, Northeast Iowa Community College hosted a webinar for their Manufacturing Alliance group. We had 80 people on that webinar. It was led by Northeast Iowa Community College as well as Cirrus from ISU, and just handling numerous questions about many of these same issues that we've addressed in this document. So we really used that webinar with 80 people on it, 80 business owners, to get a sense of the questions they were asking and identify how we could support them. And then finally, we're trying to be careful not to tell businesses this is a form you have to use because they don't, and we don't have the authority to do that. But we have provided a list of sample documents they might want to consider having. regarding their communication to employers, how they're tracking their pre-screening process, if they want to put a notice on face coverings or require face coverings, and all of those. SHRM is the National HR group association. We do have many of our human resources personnel that are members of SHRM in the greater Dubuque area. So we have provided links to their resource page. They've made their COVID-19 resources, I believe, also accessible to non-members of SHRM as well. And that would be a great resource for employers who want to start articulating some of these forms to develop them. And finally, like I said, we've started to collect a list of vendors. We know this is not exhaustive or all-inclusive, but these are based on conversations we had where we felt comfortable confirming these vendors based on conversations our office had with them, not just something we heard about or read about online. And then we will continue to update this vendor list as we're aware of more local resources. And then, of course, the original sources for the guidance. So everything in this document came from these 6 or 7 resources. And with that, I'm happy to take any questions, feedback, thoughts. The way we envision this working is really, this is a community-owned document. We'd like this broadly shared. We are not, you'll see our Greater Dubuque logos not even on it. We put this together as a framework that our community can use in communication with the employer community.
Okay. Thank you, Kristen. Do we have any questions for Kristen? And I do want to make a comment. The quality of this document stands out, and it's not a surprise to me with the efforts of Kristen and the staff at Greater Dubuque Development Corporation. So thank you so much, Kristen, for that. Any questions for Kristen?
Well, maybe just a comment and then a question. This is Supervisor Wickham. So I would also echo, well done. It looks to be a very comprehensive document. Have you received any feedback so far from the business community related to this document? And could you share any of those early indications from the community?
Sure. So we have not presented this. We wanted to make sure to first really kind of get the endorsement from the incident management team. However, we have shared the concept with our board of directors. So Greater Dubuque Development has we had an executive board meeting yesterday. I believe there were 18 CEOs on that call. We did not share the document draft, but we talked about the concept. And so there was general consensus that this is of value to the community and that it's important it is evolved. So as the information evolves, what we see as Greater Dubuque Development would house this information. We would have off of our COVID-19 page, we would have this document live. So it could potentially be downloadable as a PDF, but it would really be a live document that we can quickly update. And then we would have partners that we'd ask to share. So if you think every Friday we host an economic development collaborative call. So we have the chambers on there, the chambers and economic development groups from other cities in our county, like Dyersville and Cascade, NICC, Dubuque Main Street. All of those partners that are actively working with the business community would, be part of this network. So we would be working from one space and one document as it's updated. We would also host the webinars on our site, but would promote those on social media. We would ask all the partners to promote those on their pages as well. And in terms of others directly with the business community, I've worked with 3 employers that are pretty large employers in our community. And while we didn't have this document at the time, this was the process we walked through with them. Okay, so you're a manufacturer. How many people do you have? What's your process right now for maintaining social distance? Do you have the posters up from Iowa Department of Public Health? Do you have a screening process? And, you know, the employers are reading this information, but it's coming fast and furiously, and it doesn't always perfectly align and agree. So it can be confusing if they're supposed to be using one document or another document. So we really just have walked through it. And for the counselors, I'll count myself as one of those, although I take fewer calls than many of them have been of those 500. I think this is really a resource for all of us who are helping employers as much as it's a resource for the employers.
Any other questions? Okay, thanks again, Kristen.
Yeah, just a comment then back, I think, so I appreciate the feedback related to you know, what you've learned so far. And I generally would be very supportive of the concept. I like the draft document you have. And if you're looking for feedback related to whether this would have value in the community, I would say yes, it absolutely would in the business community that I work with. And I would be fully supportive of this initiative.
Yeah, and I do have the logos on here right now for, you know, the county, the city, and the emergency. It's the three logos: Emergency Management, Dubuque County. So, you know, I want to make sure everyone on this call is comfortable with this document becoming public and comfortable with that endorsement. I don't know if that requires anything formal. I have shared it. We've provided feedback, and like I said, we're open to ongoing feedback. But I just, before we launch this, we want to make sure everyone is comfortable with this document. So if anyone's not, let me know.
Kristen and McDonough, what does I've never been asked to make an endorsement before. What does that mean to you? What would an endorsement be?
Well, because we are talking about that guidance, we think it's important that it has the endorsement by the incident management team as the group that's recognized in our community as the kind of the guiding body for this health information and for our strategy as it relates to COVID-19 guidance. So, you know, we would not want to put something out that would ever be in opposition to guidance that this group wanted to share with the business community.
Are you going to list that it's been endorsed, or is it just that you want to say?
Yeah. Okay. I mean, right now.
Well, then maybe we should refer to our county attorney. Do we need to take any kind of steps to be sure that, you know, we've connected all the pieces independently in terms of legal assessment?
I'll just jump in. I think that's a good comment. I think that what Greater Dubuque's asking for us is our review and our familiarity with the document, and you know, having the Dubuque County logo on there is it's a visual endorsement that we've vetted this and we think the information is valuable.
Yeah, and we're happy to follow that process. Obviously, we'd like to fast track this as much as possible, you know, as we can launch this and train the helpline counselors and start getting this information to employers. Obviously, it's timely. So, you know, let me know what you need from us as next steps. I've been floating the draft and getting feedback since Monday. So I think, you know, hopefully anything substantive has already been communicated with me. Most of what we've edited have been minor.
As chair, this is on here as a work session. I'm going to suggest that we review this. We'll be meeting again on Monday, and we can bring this back as an action item. I do, you know, I would like, I think it's a good suggestion to have County Attorney May take a look at this. It would have, if it's gonna have the county, logo and, which I agree is an endorsement, we should at least have it reviewed. And, to me, it's a framework. It's not, it's not telling employers what to do, but giving them a framework and guidance, if you will. And so I think it's harmless, but I'd like to hear from our county attorney, and then we can put this back on for Monday's meeting.
It would also be good, is there maybe add a disclaimer of some kind saying that, this isn't intended to be legal advice or fully encompassing of any of your local or state or jurisdictional HR laws.
Yeah, we do have that. We do have that on there, and I'm sorry I didn't read that, but here's what our statement says. The following represents a collection of practices recommended to respond to COVID-19 in the workplace. They are not exhaustive, and they do not represent medical or legal advice to an employer in any firm.
So then, I'm generally okay with my logo being there. It's not meant to be legal advice, or it's just a resource kit, but I'm not necessarily certain we want to endorse it. Are you going to put a statement saying this is endorsed by these folks?
Yes.
Is that what you intend to do?
That is our goal. I mean, really, this came to us, one, from employers calling the helpline and asking these questions, and us relying on Google and looking at CDC and looking at IDPH and relying on a collection of links to help our employers. At the same time, we understand the incident management team was looking for a process to notify employers about information. We've been sharing the IDPH guidance as it comes out, but there hasn't really been a clear process without duplication, with speaking with one voice on how to really walk someone through this. Because, some of our employers have legal counsel. Some of our employers have 6, 10 HR people. Many of them have no HR people. And many of them have, maybe one administrator that's trying to wade through this. So we're looking for a kit to really help those employers understand what to do.
It probably is important that we spend some time then. I'm not sure, it sounds like something Mr. Raber is going to be tasked with, to make sure, coordinating with our legal counsel. Is this something I'm not opposed to a kit and to a resource, but if we're supposed to be the clearinghouse for whether or not, I don't know if Tom Berger wants to hop in, if we're going to be the definitive answer on this and it's being left to the county to do this, I don't think we have legal staff to assist with that. Maybe the city legal department wants to take this up to make sure that the information being put forward is, it's going to have some kind of a publication date with a shelf life of 24 hours, probably, with how fast the governor's making decisions. So, if it's going to be something that employers rely on, I think we're creating a different standard than generally a resource kit of the best that we have available at this time. So really it comes to what standard here do we want to hold this document to, and what is it that our endorsement means, as compared to just, the logo on the front saying it's a work in progress. We can't be a substitution for someone not having HR in-house for a company.
I believe that Ed Raber is on, involved in the meeting here, and perhaps Ed could get with County Attorney May and see if we can get a review of the document. I did highlight the disclaimer. It was on page 4 of the document. and it's right under employer framework. So would ask Ed to, in between meetings, get with County Attorney May and give us the legal opinion regarding the document. I think it's well done, and it provides guidance and some framework for our Dubuque County employers.
CJ sending it an email just says he will work with the city attorney's office as well to see. This is the kind of thing we normally would kick over to Greater Dubuque Development Corporation to put together for us, I think.
And we have shared this with the mayor and city council as well.
And have they endorsed it, Kristen?
I don't know where we're at with that. I am presenting tonight to city council, and we'll discuss this initiative, among other things.
Kristen, this is Supervisor Wickham. Is Monday okay for a final approval of this document?
Yeah, I mean, we'll work with, we're not going to launch a full deployment until we have, everybody's on board with this. This is something, like you said, kind of kicked to us to say, how are we going to communicate safety to employers? And so this is our response to that request, both from the employer community and from the public health community, to figure out a way of communicating with our employers.
Okay.
All right. Sounds like we'll have a review being done in between meetings and get this back on the agenda at our next meeting. Thank you for the presentation.
Great, thanks for everyone's.
Yeah, thank you.
Yeah, thank you. Thanks for everyone's read.
All right, we'll move on the agenda. We have item D, which is request for Test Iowa in Dubuque County. And I think Ed Braber, we'll throw it over to you.
Thank you, Chairman Baker. The message in your packet is a request that I sent yesterday morning that I had asked the supervisors for some input on, and I appreciate all the input. It is a request to the governor or the administration to engage us in a dialogue about how we could bring Test Iowa here. So it is not the same as the incident management team requesting through some official channels through the EOC a strike force over the weekend. It is asking them to engage us in a dialogue, hopefully something that the decision makers here through the Board of Health, Board of Supervisors would be able to work with the state. The opportunity that I see, the barrier that I see that I think has been identified earlier today in our previous conversations in the Board of Health meeting is that number one, Dubuque County, while it has had a number of cases, in general, Woodbury County, which is where Sioux City is in the western part of the state, yesterday they had more new cases than we've had total positive cases. So there are some other counties that are in the governor's 22 counties under continued restrictions that have a lot more incidences. And my hunch is that as the governor rolls out Test Iowa locations, that we will not be at the top of that list. So trying to figure out how can we take the planning that we have done already and figure out, is there can we have a dialogue about how we might collaborate on something as opposed to just the state sending all of their resources here. I think they'll be directing the bulk of their resources elsewhere. So I think that actually came up a little bit in the previous discussion about testing at long-term care facilities. Who would do that? How would that come in? I think that's a present example of the sort of opportunity that if we could begin to engage the state on, might help us see how in them providing part of this, maybe that's test kits or some guidance or the ability to, without individual doctor's orders, be able to test a little bit more broadly and be able to collaborate and use our resources to partner with them, including their ability to do that testing at the state hygienic lab, as opposed to us having to send that to a Mayo Clinic or potentially even the UCL locally. So that is the, I thought about actually just calling the governor's office and saying, can you put us on the list? We'd like to have a dialogue with you back here in Dubuque County to see if there's an edge that we can grasp. I decided that I would throw some notes down in writing that might help make our case. I think that there's been an effort by a number of other metropolitan counties, perhaps to the UCC, even to band together to collectively ask the state to start putting Test Iowa locations in these metropolitan counties, of which Dubuque County is one of them. However, that might be just sort of a blanket statement. I wanted to take an opportunity to kind of make sure that the administration understood that we had some particular things going on here that set us apart, that might allow us to be a good collaborative partner with them. So far, I've not heard back from that, and we may not. However, I feel like I've been informed that by our state legislators that they did deliver that. They were anticipating getting that. They were anxious to get that sort of communication. I believe that helped shape how they look at the opportunity and the challenges that they have around the state. So we'll have to wait and see. The time we did this, we didn't understand, at least I didn't understand the strike force request or the new program that Patrice talked about today. Or I think it raises the question about perhaps the state of Iowa comes in and does some testing at the long-term care facility that has an outbreak today. Hopefully that will happen very, very quickly. But then there are, although we haven't had those reports, there's a possibility that there are other long-term care facilities that maybe have not had an outbreak, but they've had one or two confirmed cases among the staff or residents, trying to figure out, is there a way that we can speed that up if the state's going to go out and do the 20 or so long-term care facilities that have already had an outbreak. If they're the first priority, trying to tease out, how can we speed up getting that testing done at the facilities that are not currently under an outbreak, but have had a positive case. So those are part of the conversations. I don't know if she's still on here, that I've been engaged with several of the Board of Health members and the United Clinical Laboratories over the last several days. So it seems like some more clarity is emerging about how those tests could be done. It would be great if Test Iowa and the state would be willing to partner with us, because one barrier would be then we would be able to, if we were able to collect those tests on our own in collaboration with the state under their auspices, being able to send those to the state hygienic lab where the governor's program would pay for those processing, might even happen quicker. So I understand that for some of you, that cost isn't necessarily the red flag, but for others it is. It certainly is a concern. So with this as a moving target, I think it's helpful to try to ask the state to look at us as a partner. I think that is our best opportunity to engage their services instead of just waiting for them to finally get to us. Among the 22 counties, we may be right at the bottom. So I understand that there's concerns about just sending this out quickly. This isn't committing anybody to anything. It is strictly just asking them for a phone call back so that we can engage them in a dialogue that the group of people, this is to a certain extent, in some cases, this is kind of a leaderless initiative. There's a lot of moving parts and a lot of different organizations and groups bring to bear on this. That would be an opportunity if the governor wanted to be on the phone or a representative of the governor. I think we could probably assemble those people that could come together and talk about how we could collaborate. And as I said, I have not heard back yet, but I am optimistic that our communication of how we could be a partner will continue to weigh on how they approach this in Dubuque County.
Okay, thank you, Ed. Thank you for taking the initiative on this. Supervisors McDonough, Wickham, any questions or comments?
Thank you, Ed.
Thank you, Ann.
No general comments from me overall, other than I appreciate you organizing those thoughts and putting those together and sharing those with the board today.
All right. We will move forward. On the agenda, item E is discussion regarding public access to county buildings. Dawn,
Yep.
Sherman will update us on this.
So you as the board had previously voted to place restrictions on public access to the courthouse and to the West Campus. And your last motion was through April 30th. In light of the governor's extended restrictions on Dubuque County, those go through May 15th. Looking to the board to see if you would like to extend those restrictions to those two county buildings. If not, then those would be lifted on Friday with regular public access.
We're in the middle of a surge. I think it would be, I don't want to speak out of school, but I think it would be crazy to change what we have in place. So I would strongly encourage expanding or extending, maybe is the correct term, our current rules regarding public access to our county buildings. I'd ask Supervisors McDonough and Wickham to jump in.
Well, this is Ann McDonough. Dawn, can you give me any context from, do we have anyone other than my opinion? Do we have consensus from our facilities manager, from law enforcement? I understand it's going to be our decision, but generally, certainly when I'm in the courthouse, which is at this point just once a week, people seem to like and they feel that we've taken good action in helping keep our employees safe and still allow the essential government services to go on. But do you have any other, anything else for context for us?
I have had nobody reach out expressing any concerns. I think everybody has figured out their groove with their operations, with the different shifts. I've made all of our department heads that are on the call the ability for them to unmute themselves if they would like to make any comments. But I would be supportive of this from the feedback that I have received from others. I think with remote working and how we have adjusted our operations to ensure when there are people in the building that there's proper social distancing. We have the cleaning facilities. We have an employee who is doing that for 8 hours a day. So I know that is appreciated by those in the courthouse.
This is Chris. My recommendation is to extend it. With everything that's going on, the fact that we went from 88 to 97 cases and from 2 to 3 deaths since yesterday's report tells me we need to maintain the level we're maintaining now.
Okay, thank you, Chris. Any other input?
Well, I personally,
Go ahead, Ann.
no, I mean, I personally am supportive of this, but yeah, I guess I jumped on if anyone else wants to share.
The auditors group, if I could jump in here for a minute, has a chat room where we normally try and keep track of what is going on in other counties. And this has been a topic of discussion. I have not, in the people who have commented, seen any of the auditors from the 22 counties where the governor has extended her guidelines. I've not seen that any of them have made any move to go ahead and open as of now. In fact, a lot of the smaller counties that are being allowed to open or their businesses are being allowed to open, a lot of those small counties are still not opening their courthouses as of yet.
Supervisor Baker, this is CJ May. If I could just chime in, I think we should likewise extend it. I wouldn't see, the court system they have the judges working from home now also, except for one that comes in just to do the 8:30 video court real quick. So I think a couple more weeks of this would be appropriate at this point and then reassess at that time.
Okay, thank you, CJ. Any other elected officials or department heads?
This is John Murphy, and very much agreed to extend this. I think the question should be the length of time more so than whether or not it should be. I've had some concerns just from staff asking if we were opening this week, and I said I think it would be, I'd be shocked if the board moved to open the facilities. But on the same page, I told them that, if that were to happen, we wouldn't be opening our office. Yeah, I think it's a question of when we do it and maybe try to have a long-term approach. And I think giving staff a little bit of peace of mind would be ideal to let folks know that, yeah, it's going to be at least a couple of weeks. I've already made our schedule out through Memorial Day in our department because I don't foresee this thing changing, and I couldn't responsibly open the office in the near future.
Hi, it's Danny. We're at the point here where we're operating. We're very extremely busy, but we have found a groove that's working for us and the public. So in our office, there's generally 2 of us in the office, and our office is spaced enough that we're comfortable from each other. We're doing our best to maintain wiping things down, when we are touching things back and forth. But I would say that I would be like everybody else and expect that we would stay closed for a little while longer. But we are operating and extremely busy because people are pulling permits like crazy because they're home doing projects. So our revenue has actually went up and not down this month. So I would just say let's just kind of keep it as it's going for now.
Thank you, Tammy.
This is County Engineer Baker. This is County Engineer Anthony Bargett. I would also support extending the quote-unquote shelter in place. I think our operations are working out pretty good right now, and one of the issues is also getting daycare for some of our employees. That seems to be a problem right now. So if we can get an extension over the next couple of weeks, that should help that situation.
Thank you, Anthony.
Thank you.
Supervisor Baker, this is Kellyanne Lee Carr.
Hello, Judge LaCar.
Hello. I would just add in that, as indicated by CJ May, we have pulled most of our staff from the courthouse. Those that are working behind closed doors. The court system does not have any intention of resuming in-person proceedings before June 1. And so I would anticipate that from our standpoint, the courthouse remaining closed with limited access for emergency court services is very acceptable to us, and we don't anticipate any resumption of services before June 1 beyond the emergency service.
Okay, thank you, Judge LaCar.
I'd like to just note that we do get, so that our general community is aware and the public, we get an update from law enforcement about the numbers of individuals scanning their card to come in and out as employees on a daily basis, as well as the numbers of individuals who are accessing the government systems through the front entrance, and how many people actually proceed on to meet with someone in the courthouse or are allowed access to the courthouse. That is, it seems to have, and I appreciate those reports from Shane. So it seems to have kind of leveled to a number where the average number of persons moving through the front entrance and actually moving into the courthouse as a member of the public is averaging one individual. So, and I think that's reflective of just really the emergency services only that are being provided through the court system. So, you know, I just want to let everyone know that we are, every time we meet, we get an updated report about the access to the courthouse itself.
Okay. Thank you, Ann. All right, any other questions or comments? Dawn, do you have a recommendation? I know it's a Board of Supervisors action. Is there a recommendation?
My recommendation would be at minimum through May 15th, and that's consistent with the governor. That would be my recommendation at this time.
Okay. Do we have a...
I'll make a motion.
Okay, thank you, Ann. Go ahead.
I'm prepared to make a motion. I'll make a motion to extend the restricted public access to the Dubuque County Courthouse through May 15th, 2020.
Okay. And Ann, can I ask if you would include the West Campus and the other affected county facilities?
I'm sorry, absolutely.
Thank you.
Yes, including the West Campus and other county facilities.
Okay. Is there a second? I will second that. We're open for discussion. The motion was made and seconded to extend the current public access rules in place for county buildings. Dawn, just this covers the courthouse, it covers the West Campus, covers the old jail.
That is correct.
Okay. All right. Is there any?
Yeah, in discussion, this is Supervisor Wickham. In discussion, yeah, I would still, I think Supervisor McDonough's point is very valid related to the courthouse. We only have one member of the public entering the courthouse, but we still have 30 to 50 that approach the courthouse. So they're not staying in their homes. And the reason they're doing that is because the courthouse is still technically open on a limited basis. And so I think that it's just a position that we could have easily changed, and we could certainly change it today. But if the options are open versus limited access till May 15th, I would clearly choose limited access to May 15th. But I think it would be a wiser and prudent choice to actually state to the public that these facilities generally are closed to the public, except on emergency cases.
Okay, thank you, Supervisor Wickham. Is there any other discussion or comment? The motion was to extend the current rules regarding public access to May 15th. All in favor signify by saying aye. Aye.
Aye.
Aye.
Carried 3-0. Okay, we'll move on. Next up, we have a resolution regarding appointment of deputies, assistants, and clerks. It's included in the packet. Dawn, are you planning on putting that up on the?
It
It's
should
up.
be sharing there.
For some
on your
reason,
screen.
I'm not. Maybe I don't have it in the right mode here. Okay. Okay, we have a resolution, and we have 6 positions from Sunnycrest Manor that we're looking for approval. Dawn Sherman, do you have any comments?
I have reviewed these and recommend approval. Again, we're bringing the ones for Sunnycrest and for the jail and any essential services to you on these meetings, so we can quickly fill their vacancies to make sure that they're at full capacity for staffing. So we appreciate you considering these.
Okay.
I'll make a motion to approve the resolution.
I will second that.
Motion made and seconded to approve the resolution. All in favor signify by saying aye.
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 Aye, carried 3-0. The next matter, and there has been a little discussion on the chat portion of the Zoom about our next meeting. We have been doing Mondays and Wednesdays. There's been discussion, at least a suggestion, maybe we try to space it out, maybe do Monday, Thursday. We could always add a meeting, and we have added a Friday meeting in the past. There's nothing preventing us from adding a weekend meeting if necessary. In between Monday's meeting and today's meeting, the universe changed in Dubuque County. I don't know that we can actually time these meetings because things are changing rapidly. I am not opposed to adding a meeting, this week, if necessary. I'm also okay with, going with Monday and, as chair, calling a meeting if necessary. If approached by Tom Berger, Patrice Lambert, or Tom Beschen, that we need a meeting, I wouldn't hesitate to do that. So just throwing that out there. Right now we're scheduled for next Monday, and that will be at 10 a.m. And that date will be May 4th. So with that being said, I think we'll, as chair, we'll go with Monday at 10 a.m. And again, if there's a need to have a special meeting, I won't hesitate to exercise that authority. Any other questions?
If I might just ask a question. I do have a question. Other things are being scheduled on Zoom. I mean, where else would we go? But so if we are going to change the pattern, I just responded to an email saying that we always meet on Wednesday, and maybe we could adjust the time for RTA, for instance. But is the pattern going to be Monday, Wednesday, or are we suggesting that it would be nice to know as we try to move things around and participate? If we knew what next week was going to be, that would be helpful. We can always add in emergency, but
I guess I'm under the assumption we're moving Monday to Wednesday until we decide not to do Monday, Wednesday.
Okay, that's what I would like to be at as well.
Yeah, that's what during the crisis, I think we've modified our schedule, and I think it's served us well. If anyone listening, that also attends these meetings thinks, strongly we should move to a Monday, Thursday, for example, I'm open to that. But otherwise, I'm comfortable with Monday, Wednesday, and the cadence we have at this point.
I agree with Supervisor Wickham.
And I concur as well. I was only passing on a suggestion or a comment. And again, it's impossible to time the events that are happening under this pandemic. So if we need an emergency meeting, a special meeting, I won't hesitate to call that. All right, anything else? All right, I guess a motion to recess until Monday at 10 a.m. would be in order.
So moved.
And I will second that.
Okay, motion made and seconded to recess till Monday at 10 a.m. All in favor signify by saying aye.
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 Aye. We're adjourned. Thank you.
Thank you.
Thank you, everyone, for your participation.